Hello, I'm Dr. Gautam Banga. I'm a reconstructive urologist and penile implant specialist working in Delhi NCR for last 13 years. So we get a lot of patients who have erectile dysfunction and they want to get an implant done, but they have a lot of queries, lot of questions especially related to inflatable penile prosthesis, that how it works and how it will be implanted into their body, whether they will be able to see or the partner will be able to see or appreciate that. So I'll try to answer each and every query one by one. So if a patient is there who is having erectile dysfunction and he has already tried medicine, have tried intracavernosal injections or vacuum therapy, and if they are not getting the benefit or if they are not getting the erection which they want, then they can definitely opt for penile implant. So penile implants are two main categories, a malleable implant and inflatable implant. But today I'll just try to focus more on inflatable penile prosthesis, which is one of the best implants which can be implanted because it gives a very rigid erection, and when the patient is not using the implant, he can easily conceal it by deflating the device. So this is the inflatable implant. It consists of three components. So one is the pump, which has a pump which consists of fluid, and we push the pump, and a button to deflate it. Then it has two cylinders which goes inside the penis, and I want to clarify that they are not visible from outside. It's totally inside the penis, so it is totally concealed. And there is a tubing which connect this implant, the cylinder as well as the pump, to a reservoir which can be of a 65 ml or 100 ml depending upon the cylinder length. So when the patient decides to go for inflatable penile prosthesis, we just check whether the patient is diabetic or no, and whether there is any scarring in and around the penis, as well as any history of abdominal surgery related to the pelvic region where we are actually going to put this reservoir. So if everything is fine, we can take the patient for surgery. There will be a small incision. I'm telling you, it's a very small incision, and after 15 to 20 days, you will not be able to see that incision from where we'll put such a big implant. So there will be a 3 to 4 centimeter cut at the base of the penis, and then from the same incision, we place the cylinder into the penile shaft, the pump with the deflation button into the scrotum, and a reservoir into the abdomen from the same incision. So the question comes, why inflatable penile prosthesis? So I just briefly told you that it gives one of the best erection in the form of rigidity, and it's the best implant which can be concealed, because once we deflate it, the cylinder totally collapses. Can you see this? Totally collapsed, and it can be easily hidden. The penis will look like a soft, flaccid penis. So there are two types of implant in the inflatable category also. One is the simple CX700 implant, and there's one which is LGX implant. So the beauty of the LGX implant is that it has a special fabric which covers it, and that fabric can expand. So when we put an LGX implant in a patient, then company also claims that, and we have seen over a period of time when we have done more than 400 LGX implants till date, and there is a definite increase of penile length by 1 to 1.5 centimeter and a similar increase in the girth. So all those people who just want to retain their erectile length even after implantation of the penile prosthesis, they can easily opt for this LGX implant. It gives the sufficient rigidity at par with CX700 and is equally concealable, but definitely increase in the length and girth, which is really satisfying to our patient. So any of you who is suffering from erectile dysfunction, or any of your relative, friend or cousin suffering from this problem, so no need to hesitate or hide behind the doors. We definitely have a very wonderful solution with us, and it's done with a very simple surgery. You have to stay in hospital for a day or two, and after 6 weeks of implantation, you can start to resume your sexual activity After 10 days of implantation, you can start inflation and deflation and go back to your routine life. So any of you who is suffering from this problem, any of your friend or relative or cousin is suffering from this kind of problem, they can reach us through Cure India. Their representative or their friends are always there to help you. The contact number is with this video, and together we can solve this issue. Thank you.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.